Today, we're diving into a crucial topic that affects millions of people worldwide: liver health. Our liver is an unsung hero, working tirelessly to keep our bodies functioning properly. But sometimes, it faces challenges that can lead to various problems. In this video, we'll explore 20 common liver issues and discuss effective ways to overcome them. Fatty liver disease, a condition characterized by the buildup of fat in the liver, often linked to obesity and unhealthy eating habits. Combat it by adopting a balanced diet and increasing physical activity. Hepatitis, inflammation of the liver caused by viral infections, alcohol abuse, or autoimmune diseases. Vaccination, practicing safe sex, and avoiding excessive alcohol consumption can help prevent hepatitis. Cirrhosis, scarring of the liver tissue due to long-term liver damage from various causes like alcohol abuse, hepatitis, infections, or fatty liver disease. Quitting alcohol, maintaining a healthy diet, and seeking medical treatment early are crucial for managing cirrhosis. Liver cancer, a serious condition where abnormal cells grow uncontrollably in the liver, often leading to life-threatening complications if not detected early. Regular screenings and avoiding risk factors like excessive alcohol consumption and hepatitis infections are essential for prevention. Liver failure, a condition where the liver loses its ability to function properly, resulting from acute liver damage or chronic liver diseases. Treatment may involve medication, lifestyle changes, or in severe cases, liver transplantation. Jaundice, a yellowing of the skin and eyes caused by high levels of bilirubin in the blood, indicating liver dysfunction. Identifying and treating the underlying cause, such as liver disease or bile duct obstruction, is crucial for managing jaundice. Liver abscess, a pus-filled cavity within the liver, often caused by bacterial infections or the spread of infection from other organs. Prompt medical treatment, including antibiotics or drainage of the abscess, is necessary to prevent complications. Gallstones, hardened deposits in the gallbladder or bile ducts that can obstruct bile flow and lead to liver inflammation or infection. A diet low in fat and cholesterol, along with maintaining a healthy weight, can help prevent gallstones. Liver hemangioma, a non-cancerous tumor made up of blood vessels in the liver, often discovered incidentally during medical imaging tests. Most liver hemangiomas require no treatment unless they cause symptoms or complications. Autoimmune hepatitis, a chronic inflammatory liver disease where the immune system mistakenly attacks healthy liver tissue. Treatment involves medications to suppress the immune response and reduce inflammation. Alcoholic liver disease, caused by excessive alcohol consumption over time, ranging from fatty liver to more severe conditions like alcoholic hepatitis and cirrhosis. Limiting alcohol intake or abstaining altogether is crucial for preventing and managing alcoholic liver disease. Liver fibrosis, the excessive accumulation of scar tissue in the liver, usually as a response to chronic inflammation or injury. Managing underlying liver conditions and adopting a healthy lifestyle can slow or prevent the progression of liver fibrosis. Liver enzyme abnormalities, elevated levels of liver enzymes in the blood, often indicating liver inflammation or damage. Identifying and addressing the underlying cause, such as fatty liver or viral hepatitis, is essential for restoring normal liver function. Non-alcoholic fatty liver disease, a range of conditions characterized by excess fat buildup in the liver, not related to alcohol consumption. Lifestyle changes like weight loss, dietary modifications, and regular exercise are key to managing NAFLD. Liver inflammation, inflammation of the liver, which can be acute or chronic and caused by various factors, including viral infections, alcohol abuse, or autoimmune disorders. Treatment depends on the underlying cause and may involve medications, lifestyle changes, or antiviral therapy. Liver cysts, fluid-filled sacs that can develop in the liver, often benign and requiring no treatment unless they cause symptoms or complications such as pain or rupture. Liver dysfunction due to medications. Some medications can cause liver damage or dysfunction as a side effect. It's essential to follow prescribed doses and seek medical advice if experiencing symptoms like jaundice or abdominal pain while taking medications. Liver trauma, Injuries to the liver caused by accidents, falls, or blunt force trauma. Seeking prompt medical attention is crucial to prevent complications such as internal bleeding or liver failure. Liver metastases. The spread of cancer from other parts of the body to the liver, often occurring in advanced stages of cancer. Treatment options may include surgery, chemotherapy, or targeted therapies to manage liver metastases. Liver failure in newborns. A rare condition where infants experience liver dysfunction shortly after birth, often due to genetic factors or maternal infections during pregnancy. Early diagnosis and medical intervention are crucial for managing neonatal liver failure. That was quite a journey through the complex world of liver health. Remember, your liver is an essential organ that deserves your attention and care. By adopting a healthy lifestyle, staying vigilant about potential liver problems, and seeking medical advice when needed, you can protect your liver and safeguard your overall well-being. If you found this video informative and helpful, give it a thumbs up and share it with your friends and family. And don't forget to subscribe to our channel for more health tips and informative content. Take care of your liver, and it will take care of you. Until next time, stay healthy and happy.